In this presentation, I will be sharing with you the strategies that I use for my fellowship exams. Most of these tips are for the clinical exam, but some are also applicable to the written. Feel free to adapt these techniques to suit your needs. Just a note of caution, these tips take perhaps a good 4 to 6 months to implement, longer if you're a very busy person, for example, a parent. If it's say about 3 months to your exam and you're already in a study groove, I suggest that you continue as you are rather than running the risk of going into a panic after watching this presentation. And with that said, let's get started. So here we have on the left, Chicago the movie, and on the right, Chicago the musical. In the entertainment industry, stage actors underrate movie actors or TV actors because the stage actors only have one chance to get it right, whereas the movie actors get to do multiple takes and have their footage edited professionally. This is why sometimes screen actors go away and do stage acting for a bit, kind of like a redeeming act. When you are an exam candidate, you are a stage actor. One chance is all you get to get it as right as possible, and when the moment is over, the opportunity is gone until, I guess, the next year. So you need to think of yourself as a stage actor, and what do stage actors do to get it right? They practice and they rehearse, and this is to minimize room for error. This was how I succeeded in my exams. I considered them to be a live performance that I had to practice for. And then once you and I pass our exams, we get to be consultants who are in fact not too different from movie actors, really, because consultants get to take their time to get things done. There are 3 stages of learning. The first one is encoding or registration. To first encode or register information, one has to be alert and paying attention. One cannot encode if they're asleep, intoxicated, delirious, or distracted. Storage is when the brain forms a memory of the information. If we think of our patients with dementia or who are in post-traumatic amnesia, this stage is impaired, which impacts on their ability to learn. Retrieval is when we have to get the information out of storage for live application. In the case of our exams, the candidate that does not practice enough retrieval will more likely fail. It is common for exam candidates to read and attempt to store, but if retrieval or practice is not done, the cycle of learning is essentially incomplete. And this is when you commonly hear candidates come out of exams face-palming themselves because they forgot to say something in the exam. They technically didn't forget it, they just didn't retrieve it. Once you can retrieve information efficiently and accurately, this means that the information has translated to knowledge. The more knowledge you gather, the more skilled you become, and eventually this translates you to becoming an expert in exams. Why is it so important to be an expert? It is to accommodate for exam conditions and then some. As an example, candidates can have bad mornings leading up to the exam. For example, the candidate may have almost had a car accident en route to the exam, or their toddler had a boo-boo and has been taken to hospital. The less prepared candidate may not be able to perform in the event of emotional stressor plus exam conditions. However, although an expert candidate may underperform compared to their usual self under duress, being an expert may be enough to get them to pass the exam. Essentially, being prepared gives you a much wider margin of error. And remember, this is your only chance to pass until you have another go again next year. There is another learning technique called errorless learning. It refers to teaching procedures that are designed in such a way that the learner does not have to and does not make mistakes as he or she learns new information or new procedures. This technique is applied in brain injury units to minimize confusion. If you ask a patient what day it is and they say Tuesday, it will be very difficult for them to relearn what day it is if it's not Tuesday. So it is best to say, "Good morning, sir, today is Monday." This avoids them having to relearn what day it is. This is based on the premise that the brain is resistant to change or adjustment. If you think about a book that you've read that's been turned into a movie, Or compare a show that you've seen as a movie as well as a live musical. Which version do you prefer? Most people would say that they prefer their first experience and are disappointed by their second. And this is because the brain doesn't like relearning things. So how is this technique applicable for exams? Instead of having multiple suboptimal versions of the same answer, when you look at a past exam paper, script the perfect answer. For written exams, practice it by writing it. For clinical exams, record the answer, play it back, and listen to it, say it out loud. And same goes for practicing the perfect physical examination. Remember, when you are writing this script, the easiest way to structure an explanation is to start by explaining normal function and then comparing it to the patient's function. I have an example in the next slide. Here's an example script to explain the neurogenic bladder. I use this script even regularly now in my practice, and I supplement it with images. So the bladder has two main functions, to store and to empty. The kidneys make urine and fill up the bladder. The bladder should be compliant and expands as it fills up. At the same time, to make sure that we remain continent, the neck of the bladder and the pelvic floor maintain a resting tone. This happens automatically. When the bladder is full, it signals the brain. The brain continues to tell the bladder not to empty until we get to the toilet. Once in the toilet, the brain then sends the signals for the bladder to empty, at which time the bladder neck and the pelvic floor will relax and the body of the bladder will contract so that urine can be expelled. And then the cycle starts again. After a spinal cord injury, these signals are interrupted. Just like how spasms develop in the legs after spinal cord injury, the bladder is also a muscle and can develop spasms. The bladder becomes hypersensitive and may spasm even when it is underfilled. The pelvic floor is also a muscle which can become hypersensitive after a spinal cord injury. Bladder spasms can trigger pelvic floor spasms as well. Simultaneous spasms of the body of the bladder and the pelvic floor may obstruct the urine from expelling, and if the pressure is high enough within the bladder, urine will reflux back into the kidneys. In the long term, this will cause kidney damage. I have a separate video on my script for amputee rehabilitation. Please contact me if you would like access to that video. To practice retrieval, you can do this by yourself or with a study group. My personal opinion is that you get maximum benefit from a study group of no larger than 3 candidates. It's often easier to maintain focus with fewer people in the group. When you can meet in person, take advantage of the situation by practicing physical examination skills. In terms of verbal stations, I suggest practicing 2 verbal stations per person every night, some months leading up to the exam. Verbal stations can be practiced via telehealth with your partner. Make sure you have your scripts ready and get your partner to correct you. On the nights that your study partner is not available, you can practice 2 stations by videoing yourself. Watch yourself back and correct yourself. For written exams, literally practice writing the answers, so much so that the answers just flow out of your pen. The other thing is to consider getting a tablet or a device that you can carry around with you all the time. This will allow you to check answers whenever you're trying to recall or retrieve answers. And remember that learning is most effective when you're wondering about something. So this should be your exam mode. It's like you're ready to go in and demolish the station. Other than having just the answers to the questions, I have a few more tips to help. To get into exam mode, try and anticipate questions. Think of yourself as an examiner and how questions can be written. What's examinable and what's not? For example, it will be almost impossible to ask you to complete an AIS examination because the spinal cord injury patient will not be able to tolerate examination by multiple candidates. Very easy stations are when images or videos can be used because they can be standardized across the country. For example, gait, a modified barium swallow, or aphasia videos. Write up your questions and then try them with your study partner. As your study partner argues with you about why it's not a good question, you will gain insight into the limitations of writing questions. You can then focus your exam preparation accordingly. To get into exam modes, also simulate conditions because context matters. Imagine changing your mobile phone. It takes that little bit more of cognitive effort every time you get a new phone. So it helps to be as familiar as possible with your exam mode. If you have 3 minutes reading time, make sure that you know what that feels like. Print out 2 A4 pages of text in Times New Roman size 11. Time yourself while reading that and gauge your reading speed. What candidates often mistake is that they read too slow and they go into a panic while reading a long stem outside the examination room door. Of course, a panic before entering a station is never helpful. However, what is usually the case is that you can read the stem 2 to 3 times over with still some thinking after that. So you need to practice this. If you have 8 minutes in a station, also practice that, so that you have an idea what 8 minutes feels like. The stations are designed so that you have enough time to answer the questions as long as you know the answers. So do not feel like you need to speak at light speed. If the examiner didn't hear your answer, they cannot give you the mark. Also wear the clothes that you will wear for the exams. This is so that you can get comfortable in them and they will get you into exam mode when you put them on. Also, the last thing you need to realize that your skirt is too tight for you to do a hip examination. If you have lucky underwear, wear them every time you're practicing your exam mode. Write with the pens that you will write with in the exam. Otherwise, practice things like your introduction. Hello, my name is so-and-so. This is a falls prevention clinic and I've been asked to review your medications. Do not skip practicing things you know because practice improves retrieval in the setting of panic. Never leave the room early. As I said before, the stations are designed so that you have enough time to answer the questions. You can repeat the answers by summarizing what you've said already by counting points in your hand. For example, you can say things like, the cause of your multiple falls are your medications. We've already spoken about your sleeping tablet or your benzodiazepine. We've also spoken about your bladder medication or the anticholinergics. And we've also talked about how your morphine-based medications could potentially be increasing your risk of falls. Remember that examiners are also human. If you mumbled an answer or spoke too fast, the examiner may not have heard it. So repetition will make sure that the examiner gives you the mark. Also practice imaging stations. In every imaging station, always mention the date of the image, the name of the patient, their date of birth, their age, the modality of the imaging, which body part was imaged, and the view. So in this example, I would start with, this is an X-ray of Mrs. XY's right knee. It is in AP view, done on the 2nd of February 2019. She is an 80-year-old lady. This will give you easy marks, it will give you structure and instantly give you confidence. It will also give a first positive impression to the examiner. In terms of the video stations, read the questions first so that you know what you're looking out for. Then play the video. As you see an answer, pause the video while you're writing down the answer. This will prevent you from having to rewind the video and getting flustered that you might have missed some footage while you were looking away. Again, common video stations are gait videos, modified barium swallows, and language impairments. I won't be able to run this video in this presentation, but this is one of a cerebellar gait. And I've just written a few questions here just as an example. Remember to also stay focused. Read your stem, and while you're doing that, start retrieving your knowledge on the topic before you even enter the room. Look around when you are at the rest stations. If you see a girl in shorts, you're likely going to examine her knees. If she's wearing thongs, you're likely going to examine her feet. If you see her wearing a singlet, you may be asked to examine her elbows, hands, shoulders, or neck. And then start to retrieve this information as you guess which examination you're going to be asked to do. Of course, it'll be slightly harder if you see a man, but his attire might give you a clue. Knowing your common knowledge is also really important. Make sure you have a good understanding of electrolyte derangements, ECGs, medications and their side effects, for example, serotonin syndrome. Have a good understanding of delirium, understand their causes, make sure you know your investigations, the appropriate management, and falls prevention strategies. These tips all sound extremely simple to execute, so in my opinion, there's really no excuse not to apply them. These tips should really come to you as second nature during the exam, and if you are truly in exam mode, you will potentially exit the exam with not a lot of recall of what occurred. The year I took my exams, I was not yet a parent, so this advice is not from someone with lived experience. Passing exams requires significant sacrifice, even when one is not a parent, let alone if you are. So my suggestion would be to commit a year to passing exams. Do it right the first time rather than having to put yourself and your family through it more than once. Perhaps work part-time and make sure you have reliable, consistent, full-time childcare. And of course, this will take time to organize. So hopefully, if you decide to do this, you've heard this early enough. Thank you.